Madam, we are live now.
Okay, yes. So,
Yeah.
hello everyone. Okay, also you are starting. Okay.
So, good evening, doctors and all the participants. I, Shuman, on behalf of Shield Healthcare, welcoming you all in today's series, that is Cosmetic Gynec Made Easy, in association with Indian School of Aesthetic Gynecology along with Shield Connect. So, today is the episode 2, that is Mummy Makeover and Overview. And today's coordinator is Dr. Poonam Mishra ma'am, and speaker is Dr. Chandri Karat madam, and Dr. Seema Sharma madam is the expert of today. So let me introduce today's coordinator. Can you please share the slide, Devdarshini? Devdarshini, please change the slide.
No problem. I think,
Yeah. So it's my honor to introduce today's coordinator, Dr. Poonam Mishra madam. Madam did her MBBS, TNB, OBGN, FAM, and FCG. Madam is the president of Indian School of Aesthetic Gynecology. Madam is the chairperson, Cosmetic Gynecology, ISA RMSIG. Madam is the member of Sexual Medicine Committee, Foxy India, and she's the director of Manas Hospital, Manas Gynae Cosmetology and Laser Center, and Miracle Aesthetic Clinic, Lucknow. Madam is practicing obstetrician and gynecologist with special interest in cosmetic gynecology, regenerative medicine, and sexual health. And Madam organized and participated as a faculty member in many national and international conferences. So with the short introduction to Madam, I want to hand over the session to Madam for further proceedings. So thank you very much, Madam, and over to you.
Thank you. Thank you so much, Mr. Suman. And it is really an honor to be here. And I'll extend my gratitude to Shield people because they have actually provided this platform to be connected to many friends and many consultants, senior ones, junior ones who are actually inclined towards cosmetic gynecology and they want to learn. And I'm really feeling honored that our expert is Dr. Seema Sharma. Dr. Seema Sharma ma'am is from Delhi and she is a senior consultant OBGYN with a special interest in sexual medicine, and she's the director of Srishti Fem Care and Apollo Cradle. Actually, she's a writer. She has written 4 books for the MRCOG and co-authored 2 books written chapters in and she has written many chapters in many books. So the best thing is that she is the co-founder of NGO Prati Sandhi Foundation, which actually is teaching many going to the slum areas and other parts all over for the adolescents and many more to make them understand about the sexuality and sexuality education. This is something very difficult, and Dr. Seema madam is doing this great job along with her daughter Niyati Sharma, who is actually their foundation has won the many awards also, and recently her daughter was in, I think Dr. Seema ma'am will be telling more about this, and I think that everybody should know about this sexuality education and the work she is doing. This is commendable actually, and she is here as an expert also. And our speaker is our own Dr. Chandni Karat, and she has got a great interest in aesthetic medicine as well as aesthetic gynecology, and she is running her Medrica, which is actually is as beautiful as she herself is. The center is yeah, because your center is like a very pleasing sensation is there once I see you in your clinic, and you are doing a lot of work in aesthetics as well as cosmetic gynecology. So our today's speaker is Dr. Chandni Karat, and the today's topic is mommy makeover and overview, because this is something which is the basic one. So I am inviting Dr. Seema Sharma ma'am. Please ma'am, just introduce this mommy makeover and overview. What is what are the things and why it is so important and why it is one of the pillars of this cosmetic gynecology. Over to you, Dr. Seema ma'am.
Thank you so much, Dr. Poonam. This was really nice being here today. Thank you so much for inviting me. So yes, deliveries and pregnancies is like our backbone, and we often deal with patients who want to come back to their natural state. But mommy makeover is not only the tummy makeover that we are going to be talking about, but it also is the makeover of the intimate parts that we should be not neglecting. It is every gynecologist's prime duty to see to it that she regains her pelvic muscle strength after delivery, and advise her Kegels exercises or muscle regeneration, along with the sagging muscles and strias that are very common, that, that is part of only a cosmetic gynecology, but mostly people will not come to us only for stria removal. They come to us essentially for an overall makeover. So along with the psyche of the woman, we need to kind of correct her physical and the intimate health as well. So I would just hand over the mic to our speaker, and we would summarize towards the end. Over to you, Dr. Chandi.
So should I share my screen first?
Yes, please.
Yes, I'll go ahead. Is it getting shared?
Yes, madam, it is shared already.
Okay, so how do I get out of this view?
No, madam, make it full screen. Just.
Okay. You want me to put it on the slideshow?
Yeah. Yes.
Okay. Just give me a minute, please.
It's fine, ma'am.
Okay. So is it all good?
All good, ma'am.
Okay. So foremost, thank you very, very much, Dr. Poonam Mishra ma'am and Dr. Seema Sharma ma'am, for such kind words. And at the outset, I would like to thank two very, very inspiring and kind-hearted, mentors anyone would ask for. It is indeed an honor and a privilege to be sharing these visual platforms with the two best, our country have in cosmetic gynecology, with no exaggeration at all. I think everyone would agree on that. And definitely, I extend my gratitude to Shield Connect. Thank you for giving us this visual platform wherein cosmetic gynecologists and people interested and inclining towards it can get connected pan-India and beyond. And thank you each and everyone for squeezing in time from their busy schedule and coming over for this session. So, well, without any further ado, I hit start today's session, which is the Mommy Makeover. So, is it moving well?
Madam.
Am I audible? Are the slides visible?
Yes, madam. Everything is fine.
Okay, fine. So I start with this proverb which states, a smart mom is always beautiful and mommy makeover adds glory to her individuality. Well, what does it actually mean and what I'm trying to say by this? It's not moving. Okay, yes. So what is mommy makeover surgery? So, well, before that, the reason why, this topic has been chosen for today, or what is the need, why we even need to discuss about it and talk about it. So, well, if we talk about statistics globally, every female who has been through pregnancy, through childbirth, will require some or the other form of mommy makeover. May it be surgical or non-surgical, that is, may it be invasive or non-invasive. So when I say almost every female, so you can understand, there is such a high need, And to be very, very frank with you, coming to cosmetic gynecology, we always, when I started my journey, the scenario was such that, there is lack of awareness, and people and patients need to be vocal about the fact. There is a lot of embarrassment and hesitancy. But believe me, down the lane over the years, I have realized that, patients want to speak up. They want to come over. Thing is, they want someone to hear them out. It is not the patients. To be very frank, the sad and the bitter truth is doctors are not sensitized enough. We need to be competent enough. And because the beauty is, with science and technology in hand, we have so much more to offer our patients right now. And, I think we should do the best we can. Because we were handcuffed as gynecologists down the lane many, many decades ago. But now, with this birth and boom of cosmetic gynecology, which is growing by leaps and bounds, I think we should offer the best we can to our patients. And for that, we need to get well acquainted and well aware with what we can. So moving on further as to what is mommy makeover surgery. Well, when you become a full-fledged woman, especially after becoming a mother, and feel beautiful inside, well, don't you feel the desire to feel equally beautiful outside? Well, the answer certainly to it is yes. And why shouldn't you? After all, a woman is one of the most beautiful creations of God, and she must choose to remain so. So what is mommy makeover surgery? Motherhood is such a kind of experience that comes with an abundance of happiness and tons of roles and responsibilities. Unfortunately, even the physical changes in the body are inevitable and happen as a natural phenomenon. The saggy breasts, stretch marks, and fat deposition across the belly and the hip area can dampen the self-confidence of the mother. Mommy makeover surgery is customized. When I use the word customize, it's like in inverted commas, because it is tailor-made, catering to the need of the patient, the need, what the patient is looking for. Every patient profile is different, and it should cater to what the patient is looking forward from this procedure. So the surgery is customized according to your needs, that is the patient's need. The procedure will offer you the sculpted body like it was before the pregnancy or childbirth, and boost your confidence as well. Well, when we make a mention that it will offer you a body as it was in the pre-pregnancy state, well, will you revert altogether like you were before, or you a little closer to it, or how much more? Will throw much more light on it in our following slides. Well, a mommy makeover surgery empowers a woman as it helps you in attaining a contour body figure, a healthy glowing skin effectively by the combination of surgery, by the combination of surgical as well as non-surgical procedure. That is both, invasive as well as non-invasive, depending on the patient's need, including liposuction, tummy tuck, breast lift, facial rejuvenation, and additional skincare treatment. The mommy makeover surgery must be performed by the expert cosmetic surgeon who can understand your present needs, realistic expectation, which is very, very important and which is the key, and could meet the attainable goal by employing the right technique for the present concern of the problem. So let's unravel about mommy makeover procedure, what exactly it is and what all can we offer our patients. So here the key points for today's discussion, this is a kind of a sensitization wherein we'll be giving an overview of the mommy makeover. So the points we will, the things we will be catering to are what is mommy makeover, who are the ideal candidates, or who all can opt for it, how is it done? We can just we'll give you an overview of it. Where the pay should be sound enough, so we'll throw light on that as well. Why is it done? And definitely the cost factor and much more. So mommy makeover surgery has grown in popularity in India and all over the world in the last decade. It allows the aesthetic surgeons to address multiple problems in a single procedure, as time is our most valuable commodity. Any procedure which can safely and effectively rejuvenate your abdomen, breast, intimate area, and entire body on large at the same time definitely sounds a boon. Well, moving on further, It is one of today's most popular combination plastic surgery techniques designed specifically to address the issues and concerns related to pregnancy and breastfeeding. Surgical procedures have made its way into the mainstream media, where it has become the procedure of choice for many celebrities as well. Well, let me be very frank with you. It is not only the celebrities, but everyone out there is keen in knowing what it is, and people who are well aware, they are even opting for it with fantastic results. The term mommy makeover refers to a specialized combination of body contouring procedures performed in tandem to improve the physical changes that occur after pregnancy. So, well, why is it so popular? The procedure has no fixed components. As I made a mention, that it is customized, it is tailor-made, depending what the patient is looking for, according to the needs of the patient, we customize it. So, accordingly, you can combine 2 or more surgeries, of course, keeping in point the safety and the effectivity. And that's the reason, there is no such fixed components that, only tummy tuck and breast surgeries can combine. No, depending on what she is looking forward for. Each procedure is tailor-made. This is determined only after examining the patient's body aesthetics and goals thoroughly. Usually, the surgeries involved in a mommy makeover are breast shaping. When I talk about breast shaping, it can be breast augmentation, breast lifting, breast reduction, or a combination of any of these. Well, further, there is body contouring, there is liposculpting, thigh shaping, butt shaping, vaginal tightening, and so much more. Well, the breast aesthetics and the tummy tuck, frankly, form the core of mommy makeover. Of course, we club them with the intimate surgeries or other surgeries like the thigh lift or the arm lift, even facial contouring procedures, depending on the concerns which are bothering the patient. So this is just a kind of a gist of what we just discussed, that what is mommy makeover procedure, or usually a combination of body contouring procedures designed to restore your pre-pregnancy body, can address excess fat, your breast, thighs, buttocks, and more, can tighten loose skin and help with cellulite as well. So yes, it's said that a picture speaks a million words. So this picture you can actually see when we talk about how we can work with breast, talking about breast aesthetics. There can be augmentation using implants, using fat. Nowadays, we actually augment fat with PRP as well for fantastic, good, long-lasting results. Breast lift, breast reduction. Then we have the tummy tuck, the liposuction, feminine rejuvenation, and yes, so much more. So let's skip this one for now and move further. So why to opt for mommy makeover surgery? Will each and every female require one? Well, before that, let me tell you that we are definitely not here to propagate that every female will be requiring, or every female should opt, not only per se for mommy makeover surgery, but for any aesthetic procedure or operation. It is a patient who decides, when is the right time to opt for is when you feel the need, when you feel any part of your body is bothering you, it's concerning you. It be a functional issue, be it an aesthetic issue, be it a cosmetic issue, whatsoever, but the patient is the deciding factor. So why to opt for one? So these are few questions which you can throw on your patients. Have you recently gone through pregnancy and childbirth and your body is experiencing a huge change? Well, are you experiencing stubborn fat deposition, flaccid abdominal muscles, sagging, and loose skin issues? When I talk about stubborn fat, it is very, very important that, even when we talk about liposuction, there is a myth that it is a slimming operation or a slimming procedure. No, definitely not. Liposuction are actually, it works on areas, or it should be indicated on areas of stubborn fat. No matter what amount of dieting you have done, no amount of exercise you have done, but those fat pockets, they refuse to decrease in size or go away. So that is, in a very simple terms, how I explain stubborn fat. Do you need a rapid result as you have got fed up with regular exercise and diet control programs? So, if the answers to any of this is yes, probably then you should be opting for mommy makeover. The simplest answer is to feel more confident and happy in your own body. This is in fact the foremost one. Is it a normal phenomena for women to, it is a normal phenomena for women to lose their body shape, their breast aesthetics, the tightness of abdomen, both skin and muscle, and other body parts. The original shape and size after becoming a mother, and after breastfeeding, it undergoes a lot of changes. Many females suffer from extremely low self-esteem, and they ditch their favorite outfits owing to this unattractive look and appearance. So when remedy to this depressive behavior and suppression of desire is available in form of mommy makeover, then why not opt for it? This is what exactly in my opening of the session I said, that, you know, now that we have science and technology in hand, we have finest techniques available, we can customize a treatment, then why not offer our patients? So why get a mommy makeover? So these are again a throw chart, you know, in which it is like remove fat pockets, lift breasts, and of course, personal reasons. So moving further, who is a candidate, you know, who is an ideal candidate for mommy makeover? Well, definitely healthy individuals, meant for non-smokers. If you are a smoker, then you actually need to quit minimum 4 to 6 weeks before you plan to go for one. Someone who needs many procedure, you know, the beauty of mommy makeover is you can combine 2 or more procedures, okay, keeping the zones of safety and effectiveness in mind. So 2 or more procedures can be combined in the same sitting. Okay, best patient profile would be someone have done having children, and yes, so this is again a go-through one, that as I told, mommy makeover, you should do it for yourself. The procedure will boost your confidence. Okay, you may be a candidate for this procedure if you fulfill all this criteria. Is one, must be fully recovered from childbirth and breastfeeding before undergoing surgery. One must be physically fit, definitely. One should have a positive attitude and realistic expectation from the surgery, which is so very important and very, very crucial part of our consultation. Well, when to opt? Now we know that, you know, who can opt for it, who is an ideal candidate, but what is the right time to opt for a mommy makeover surgery? So, well, ideally, once you have completed your family and at least 6 months after the last childbirth. If you're breastfeeding, we advise you, it should be minimum 6 months after you have stopped breastfeeding. Any mother who desires to get a pre-pregnancy body back can go further without any second thoughts. However, not all mommy makeover procedures are created equal, and combining procedures for every patient is not always appropriate. We need to understand this thing very crystal clearly, that a mommy makeover isn't a one-size-fits-all procedure. It should be tailored to specific needs of the patient, the lifestyle, the anatomy, and goals that patient wants to achieve. Of course, it's an IPD procedure with approximately 1 to 2 days stay in the hospital. And if we are doing, it depends what surgeries we are combining, the stay could be a little longer. So there are definitely few things which you should know before opting for mommy makeover surgery. So please give me a minute. Yeah. So what procedures might be in a mommy makeover? As I said, it's a combination surgery. Depending on the needs, concerns, and issues, we can combine 2 or more in the same setting. So there could be breast lift for saggy breast implants, tummy tuck, liposuction, labioplasty, thigh lift, arm lift, dermal fillers, of course, facial aesthetics as well. Okay. Areas which can be treated by mommy makeover. There are different areas and customized combination taken into consideration in the mommy makeover procedure, as we just made a mention of, you know, right from augmentation to lift to reduction to liposuction to vaginal rejuvenation to stretch mark treatment to facial treatment. I'm not. Can you hear me? I'm not able to move my slides quite well.
Yes, madam. Perfectly.
Okay, because it's getting stuck with every next slide. Anyways, mommy makeover surgery spectrum. There are different procedures that are involved with this procedure. So we will be just talking very, very briefly, because every procedure mentioned here is actually a topic of discussion in itself. So we are just going to throw some light as to what all procedures we actually cater when we talk about, or when we use the terminology of mommy makeover. Well, breast augmentation. Breast augmentation helps in providing fullness and volume to the breast area. The weight fluctuations and nursing distort the volume of the breast. Breast implant or fat injection into the breast provides volume to the chest and restores its fullness. Now depending upon what patient wants to have or wants to opt for, rather, we have right from breast implants to also augmentation of breast using fat. And as I made a mention, we also do it in combination with PRP, and it's really giving very, very effective results. Breast lift to raise sagging breast to a perkier position. Now, the breast lift can be both invasive as well as non-invasive. Of course, surgically we can do. We can also do it with a HIFU, which is non-invasive. Of course, we have threads for breast as well. That is the thread lifts. The procedure of breast lip surgery will remove the excess hanging skin in the breast area and raises the remaining skin and tissue to provide a firmer look. The breast lift is combined with breast augmentation, depending on the needs of the patient, to improve the shape and position of the breast. Liposuction. Liposuction to remove fats from the abdomen, back, thighs, hips, and buttocks. Liposuction removes the pockets of fat from various body areas. This is actually the stubborn fat when we mention fat over here. The procedure is commonly combined with lift procedures like tummy tuck and lower body lift in order to create a more sculpted figure. Tummy tuck to give a firm shape to the abdominal area. Well, tummy tuck surgery provides a firm and toned look to the abdomen area. After pregnancy, the abdominal muscles weaken or get separated after childbirth. The tummy tuck tightens the abdominal muscle, removes extra fat, and creates a more toned contour. The procedure also removes extra skin. Most of the stretch marks below the navel will be removed. Well, it's stuck again. I'm very, very sorry. I don't know what glitch is this. The slides aren't moving. I really don't know.
Madam, now it's stuck. Madam, just put this down arrow.
Down arrow. Okay. Okay.
Yeah, it's changed, madam. You please use down arrow.
Okay, fine. So vaginoplasty, childbirth can change the anatomy of your intimate areas. The changes might be only visible to you and your partner. It can affect your intimate moments with your partner by changing your way of sexual gratification. If you have a natural delivery, you might experience some losing of the vaginal canal. This can have a negative effect on your sex life. The procedure of vaginoplasty can be done with laser non-surgically or with surgical methods, of course. It helps in tightening the vaginal canal by reducing the diameter. The procedure can be repeated and does not interfere with giving birth. Labiaplasty. Some women might experience uneven or overly large labia after childbirth. Hyperpigmentation of the labia is also quite common. If you want to change the way your labia look, then labiaplasty procedure is the best option for you. Well, of course, we have laser skin resurfacing. This procedure also includes skin treatments that can help repair many skin issues that one might encounter after childbirth. The laser treatment includes removal of stretch marks that is evident during pregnancy, removing or minimizing colasma, also known as the mask of pregnancy. Well, these things are very, very important, that when a patient steps in for consultation, what are the points that you need to discuss, especially when it comes to aesthetics, everything, even the finer details need not only to be discussed, but also we need to jot it down. Everything needs to be on record right from the discussion, the expectation, what results we are probably expecting, and the photography is a must for any aesthetic consultation. At the time of consultation, you are free to ask questions to your plastic surgeon and he will answer your every query related to your concern. One must keep this fact in mind that pre-procedure consultation helps define the goals and outcomes of the procedure, as every patient is different and everyone has a different concern to receive the procedure. However, it is inevitable to receive a consultation session to help you to identify the status of your problem. Well, during your mommy makeover consultation, be prepared to discuss the following. Foremost, your surgical goals. What exactly are you looking forward when you go under the knife? What are your expectations? How realistic are those expectations? And as a surgeon, it's a rule that we never ever say, even if we are very sure the results are going to be close to 100%, never even utter those words. Always give them realistic expectations. If you feel, yes, you're going to do a fantastic job, everything, the patient profile is great, there are no risk factors, nothing involved, but always still say around 70-80%. We need to work on that safety zone, in that safety zone. Well, other thing are medical conditions, of course, drug allergies and medical treatments, current medication, vitamins and herbal supplements, alcohol, tobacco and drug use, any previous surgeries, as we do for all of a consultation. Your mommy makeover surgeon will also evaluate your general health status and any pre-existing health condition or risk factors. May take photos. These are actually a must. Discuss your procedure options. Whenever a patient comes, is willing for a certain procedure, we need to offer them, give them options of both invasive as well as non-invasive. And then, of course, as a surgeon, what you feel would fit best for this patient, and then let the patient choose. Recommend a course of treatment. Discuss likely outcomes of and any risk or potential complications. It's very, very important to discuss every bit, be it some minor complications or major. One may have a number of questions to ask, but one must introspect each question with respect to the concerned problem. Hence, it is good to make a list of important questions before proceeding to the consultative step. Types and techniques of mommy makeover surgeries. Well, many factors should be taken into consideration when choosing which techniques are best. The desired amount of restoration, the placement of incisions, the type of implant used, and so on and so forth. Well, the surgery execution. How should I prepare for a mommy makeover? In preparing for the procedure, you may be asked to, of course, get lab testing or a medical evaluation, take certain medication or adjust your current medication, stop smoking, avoid taking aspirin, anti-inflammatory drugs, and herbal supplements as they can increase bleeding. This surgery is typically performed in a hospital or an ambulatory procedure setting and will likely use general anesthesia. Some follow-up procedures may be performed on an OPD basis, and local anesthesia with sedation may be used. These decisions will be based on the requirements of your specific procedure and in consideration of your preferences and your doctor's best judgment. So what are the steps of a mommy makeover procedure? As it's an overview and a topic, it's a sensitization. So we'll not go in much detail. So of course, medications are administered for your comfort during the surgical procedures. There is IV sedation, there is general anesthesia that is used, and your doctor will recommend the best choice for you. The surgical procedures are steps for various procedures that could be a part of your individualized mommy makeover procedure can be found below, depending on, as we have discussed, the needs of the patient, the requirements of the patient, what the patient is looking forward for, from the procedure or the operation. Accordingly, we will choose and we'll decide what all procedures we can combine. So this is just for a tentative idea that the time required, it of course depends, what combination surgery are we doing, what 2-3 surgeries are we combining together. So anywhere from 2 to 4 hours or a little more beyond. Anesthesia is general. The pain level, of course, we have so many things in hand now. So it is very well managed. The hospital say depends from 1 to 2 days. And, there are a lot of, international clientele who, fly in specially for these surgeries. So you should have a tentative idea as to, how much time can they, wind up in. And success rate, it definitely has a good success rate, but of course it depends, who is doing, where you're getting it done from, and, all minor details and finer details need to be discussed with. Result of mommy makeover surgery. It is a combination of different procedures. We know it very well by now. The result is visible immediately and goes on improving for 6 to 8 months. It's very, very important for the patient to be very, very patient when it comes to results, because frankly speaking, over the first week, there will be a lot of swelling and gradually it will decrease. By the time it is 4 to 6, or say maximum 8 weeks, it will be a comparatively, you can say, more reduction of around 30 to 40% of the swelling. But for the final results, there are times where you have to wait from anywhere from 8 months to 10 months. That is close to a year. So patient should be very well counseled about this. All such things need to be discussed. It is definitely not a magical wand, especially when you go for invasive procedures. There is a lot of downtime also which is involved. One has to lead a healthy lifestyle if one wants to maintain the result. Of course, yes, it goes hand in hand. It's not only having the finest surgeon to operate your procedure or the operation, but the post-op care, the results, in the long run matters a lot. If the patient has been following whatever has been instructed to the patient. With time, the implants will settle and scar lines will improve. But mostly women feel these are small compared to the large improvement in their self-confidence after surgery. Definitely. Most of the patients you will see, I've seen so many patients in my consultation who will come over and, they want this mommy makeover, and they'll say, okay, so everything will done and sorted. I have no scars on my body. And when we say, of course, there will be scars. These are invasive procedures. So they say, no, we don't want scars. So understand one thing, for a bigger, larger improvement, those small minor scars, and which definitely heal with time. And we have so many other options for scar reduction. So there is a basket full of options. But then, yes, in the beginning, you will have certain signature marks on your body. Following your surgeon's instructions is the key to the success of your surgery. It is important to know that the surgical incisions are not subjected to excessive force, abrasion, or motion during time of healing. The resting period is very, very, very important. Recovery after mommy makeover surgery. This is very important to discuss with the patient, because there are a lot of time, of course, in a lot of cases, in fact, not only for cosmetic procedures, for every procedure, there are a lot of things which boil down to money. But at times I have seen that money is not the factor, that time is the factor. At times they have time both, but they don't have anyone to take care of them, or probably if the baby is small, you are doing the surgery when your baby is somewhere close to 1 year old, or, around that. So you want somebody, a caretaker is important. So, everything needs to be in place. Mommy makeover recovery depends on the procedures. Rest is very, very important. Of course, there are drains, there are compression garments, which are recommended to the patient. Back to work within few days. You need to exercise, after a certain number of weeks, depending, how invasive we have gone with your surgery. Results, as I made a mention, that 4 to 6 weeks, but for the final best results, you have to wait over a month, over months. We recommend no more pregnancies or breastfeeding. Recovery time is different for different mothers. That's so true, depending on the type of treatment one is undertaking. However, the procedure takes 2 to 3 weeks to recover completely. After the procedure is completed, you will be asked to apply. Okay, so this is actually what we share with the patient when we take individual topics in detail. So this is the, this is probably one of the slides where we can discuss at that time. So benefits, mommy makeover procedure is tailor-made, keeping in mind each individual's needs and goals. This makeover procedure includes combination of various surgical and non-surgical procedures to help you get back your pre-pregnancy figure. The procedure will boost your confidence and help to share those inhibitions that you have been holding after childbirth. One can opt for many procedures with multiple benefits. One of the benefits of this procedure is that you can combine different surgeries according to the needs in one go. The recovery time will be less, and one can even get back to work without taking repeated leaves. Health improvement. After pregnancy, you might put a lot of weight, which is resistant to any form of diet and exercise. So regaining your shape and starting a new beginning to take care of your health and weight is, mommy makeover is the procedure for that. Although there is no alternative to a healthy lifestyle, with a mommy makeover, one can at least bring the weight to an optimum level. So you need to get over from worries and obsession. After pregnancy and childbirth, it is very important to understand that, the first 6 months, you need to give time for things to settle down, because that is a time where even baby needs your attention, needs your focus. So, and also you're on the phase of puerperium, just following your pregnancy. So let things settle down, and gradually, you can choose which all areas of your body are concerning you're not happy with. And of course, we have so many options as we discuss. The constant caring and nursing of the baby might reduce the sex drive for many mothers. Natural birth also enlarges the vaginal canal, thus reducing the sexual urges, which could be a cause of concern. The vaginoplasty and labiaplasty can take concern for these issues and provide the best solution. Thus, it acts as a key factor for improving intimacy with your partner. So definitely not only on the part of the surgeon, but also on the part of the patient, a mommy makeover takes intense planning and preparation. It is a very safe procedure. However, all forms of, we are actually throwing light on what possible risks are involved. However, all forms of procedure come with certain risk and complication. Modern technology for surgery, anesthesia, sterilization, precise protocol-based management, and a caring team make the surgery a safe and life-transforming decision. Well, it's definitely a game changer, but there should be a lot of motivation. The patient should be ready to follow the post-surgery protocol as well. Throwing some light on the cost. Of course, cost will vary based on many factors, what procedures you have opted for, the quantity of fat we are planning to remove, the fees of anesthesia, of course, the outpatient facility, the medical testing, that is pre-procedure workup, and so many other things, the hospital facility and the stay, the technology which we are using, of course, there'll be follow-ups which will be involved, and post of medications. There could be some rare and unforeseen health circumstances. So, and it's very important to know that by far insurance is not covering any form of plastic or cosmetic surgeries. So how various factors affect the cost of mommy makeover surgery is definitely patient profile itself, because you need to correct the concerns, how is the general health of the patient and what the patient is looking forward from. The surgeon's profile is very, very important. Choose, always go through, make sure whom you want to get operated under with. Okay, accreditations are very important. What kind of work your surgeon has been doing. There are a lot of surgeons, being cosmetic or plastic surgeons, they are specialized in certain domains. So accordingly, do the field work well. Fees of the anesthetic, of course, the infrastructure of the center, it's very, very important. Wherever you choose to do, be it an invasive procedure or a non-invasive walk-in, walk-out procedure, the center needs to be very well equipped. The ambience plays a very, very important role. Even in post operation, a good ambience is definitely very soothing. It helps in the recovery of the patient as well. The hospital stay, medicines, follow up, we have already thrown light on this. So of course, there are a few more questions very commonly asked is how soon can I have a mommy makeover after childbirth? Because understand, in a lot of patients, they slip into depression looking, when they have a look at their body that, pregnancy has distorted and disfigured a lot of body parts. So in that case, you need to counsel your patient well, advise them to wait for another 6 months. If she is breastfeeding, 6 months after she has stopped breastfeeding. And then there are questions like, can I conceive again after mommy makeover surgery? So yes, definitely. Of course, it's always better to complete your family before you're contemplating the procedure, but you need to, because of course the future childbirth will alter the results of pregnancy. So the best time is when you have completed with your family, with your desired number of pregnancies. So that's the most ideal candidate. Is it possible to remove the cellulite with mommy makeover? Yes, definitely. We have a lot of options in hand. Is the procedure of mommy makeover painful? So, well, you are undergoing a surgery, but as I made a mention, we have, so many, what I can say, the post-op relief is really in par with the medications in hand. So, patients are quite at ease if you medicate yourself on time and well. Does mommy makeover remove stretch marks? So, well, when we do a tummy tuck, the stretch marks which are concentrated in the lower abdomen, that portion, yes, you get rid of, but the rest of the stretch marks, we have so many other options like from fractional laser and so on and so forth. How many areas can be treated in one session? Many problematic areas we have already run through this discussion, and definitely it will depend on your body structure and how many procedure you can endure. The safety of the patient is the key deciding factor in surgery. So what do you expect before your mommy makeover is all the pre-work, the lab work which need to be done. Of course, as I told, if you're a smoker, you need to quit smoking, and you need to make sure that after the surgery, you get the optimum care which you desire. And of course, the benefits are so many, right from your self-confidence to greater freedom in clothing selection, to no more padded bras, no need to wear compression or shaped garments, increase in self-esteem, the confidence to wear swimsuits or other form-fitting and revealing clothes, increase energy, and greater enthusiasm for an active life. So there are certain facts which we all need to be very clear with, that mommy makeover shouldn't be done immediately after childbirth, as we just discussed. Okay, it is customizable, that it is tailor-made according to the needs, concerns, and issues. One can get multiple surgeries done. When we talk about mommy makeover, because pregnancy is one thing which actually takes a toll on the physical appearance of most of the female, but it is not only restricted to mothers. Anyone who wants to go for combination surgery, who wants to go for tummy tuck, liposuction, who have saggy breasts, irrespective whether you have delivered a baby or not, you can go for it. It is not that it is restricted per se only to moms. It will not give you instant results. Yes, you should be prepared for it, that it's not a magical wand, or you have to be very, very patient when it comes to results. Of course, this is a part, a very, very important part is vaginal rejuvenation surgery. As Dr. Seema ma'am very rightly said, that the intimate area is something that females need to be vocal about. The problems are equally important. It could be functional, it could be hampering your sexual life, so you need to be vocal about it. There's so many great options and procedures we have that we can offer to our patients, right from vaginoplasty to augmentation, labiaplasty. Of course, if somebody is looking to augment the labia minora, the puffing of labia minora, and so much more, even for someone who is having a problem with orgasm, so orgasmic dysfunction. So we have so many shots which are done on step in, step out procedures which we can offer to our patient. Well, there are definitely a lot of myths. So just to run a few of them, a vaginoplasty can help you acquire a complete pre-birth, pre-childbirth like vagina. Absolutely a myth. No surgery can revert it back. It's a very, very natural phenomena. It's possible to drastically change how a vagina normally looks. Well, that's definitely a myth. Vaginoplasty can be done for birth control. No way is it related. You need to seek your gynecologist for the birth control options. A vagina can be tightened with topical creams and zero invasions. Well, when I make a mention of this slide that vagina can be tightened with topical creams, there are so many ads, which run through on the internet and otherwise, which are claiming that, you can just tighten your intimate area using certain creams. So it's just a marketing gimmick. Please do not fall trap to such ads. And this picture I have just placed in because, there are a lot of markings which are involved. So when you plan to, step into cosmetic or aesthetics and, you work in collaboration with plastic surgeons, but then, this kind of gives you a view that, markings are very, very important. You should be knowing exactly which part you're planning to contour, where you want to do liposuction, is she looking for a hourglass figure, or what is the patient desiring for? And yes, definitely we need to help out all our patients out there. As I made a mention, patient, they kind of slip into depression looking at their post-pregnancy bodies. And we have so many options now. Looking at this for stretch marks, I think Dr. Poonam Mishra ma'am is the best one who can, she does carboxy therapy the best. So right from carboxy to fractional lasers to even microneedling with PRP, we have so much for stretch marks as well. As I made a mention, the stretch marks in the lower abdomen, when we do a tummy tuck, those stretch marks are removed, but then there are quite some, in the upper part on the side. So then we have options for that as well. This is something very, very important. I believe no presentation, no aesthetic or cosmetic gynecology or any plastic surgery presentation would be complete without mentioning about BDD, which is a body dysmorphic disorder. It's a psychological problem wherein the patient feels that she is highly flawed. There could be some minor corrections or something which she might be genuinely having, but then it's like, in her view, it's really blown out of proportion. She feels that she needs very huge corrective surgeries, and the patient also keeps on going from surgeon to surgeon, keeps on opting for new surgeries, and patient is never satisfied. So we need to pick this up very, very clearly in our consultation. And of course, it would be very unfair, though we are not going in very invasive talks, because as I made a mention, every procedure, right from tummy tuck to breast aesthetics to vaginoplasty, labiaplasty, and so much more, is a topic of discussion in itself. But then, we can definitely appreciate and have a glance of what results we normally get. These are real-time picture photos. If you see the pre-op, and if you see the post-op, you definitely see a flatter abdomen. The breast, they are definitely not saggy. They are firmer. They are uplifted. The baseline definitely has good definition. Flatter abdomen, as I made a mention. So, you can really appreciate the results are totally worth the surgery. This is one more picture in which we can appreciate the results as well. When I talk about tummy tuck, tummy tuck is a synonym we also call as an abdominoplasty. Now understand that, abdominoplasty and liposuction, these are two different things. Only if you do liposuction for a patient, that is merely if you are trying to suck out the fat, to put it in very layman terms, it's not really going to work. Because there is so much of weakening of muscles. You can not just remove the muscle. The patient also want a good aesthetic look, a good contouring, a more athletic look. So, there's so much weakening of the muscles. So the thing is, we need to actually tighten the muscle, do a good abdominoplasty. So the ideal is going for lipo plus abdominoplasty, which we term as lipo abdominoplasty, and it should be ideally a 360-degree one. When I say a 360-degree one, you cannot be just working on the abdomen or the frontal aspects. There are so many other things, right, from contouring the waistline to to working on the other parts of the body. So that is very, very important. And yes, definitely. There is so much more, we can just, the spectrum of when it comes to mommy makeover, the spectrum is really, really large. We can just go on and on with it, but this is just an overview so that we know exactly what all we cater to and what what all and so much more we have in hand to offer to our patients. So yes, I wind up my presentation on that note. Yeah, so thank you for all the patience. Yes.
Thank you so much, Dr. Chandni. That was an awesome presentation, and it really gave a very wholesome panoramic view. I mean, this was really beautiful. I didn't want it to finish. Thank you so
How
much.
sweet, how sweet. So
Really,
kind of you.
we would want to have more detailed discussions in the coming sessions, I
Definitely.
guess. This is very good. I would totally agree with what Dr. Chandni says. We must ask the patient her expectations, because a lot of times, she expects a very flawless model-like body. And also when, people come to us for striae removal, even if you are doing the laser, we must tell them exactly what's going to happen. It's not that the skin is not as flawless as if there was no stretch mark before. So the stretch marks would tighten depending on the kind of stretch marks she had to begin with. Have very bad brown raised striae. So they will become flattened, they will become little lighter, but they will not disappear at all. So very realistic expectations. And also in my practice, I've seen a lot of people asking for breast reductions and augmentations rather than asking for enhancement. Also, I saw a very interesting patient a few months back who had a huge saggy breast, and she had an upper arm neuropathy because of that. Because she had big fuller breasts and she was going down, and she was developing neuropathy, and also intratriginous area was developing fungus again and again. So when she got her breast lifted, of course it was done by the plastic surgeon. When it was done, she found relief. So it is not only cosmetic, it is sometimes also medically indicated, the
Absolutely.
makeover.
And you're so very right, ma'am, because, actually the scenario is such that, almost every third or fourth female, they want to go for breast augmentation. There's a lot of inclination. But actually, the real fact is we have equivalent figures for patients opting for and willing for breast reduction, because those with heavy breasts, they have a very tough time with severe backache and sagging, and it's very troublesome.
Yes.
So, yeah.
And also they are always concerned about their breast shape, and they're stooping down to hide that.
Correct.
And that's cause issues as well.
And ma'am, as early as there is one patient who recently got operated. She was just 18 years old, with such heavy breasts, and she couldn't take it. Her mom was, literally she was sobbing and crying through because she had such severe pain, severe backache. So for those patients, as I said, mommy makeover is not per se only for moms. There are so many surgeries which at any age group, even for someone at 60 who is not happy with her body shape or any disfigurement, can opt.
Yes. Well, that was wonderful, Dr. Chandni. Thank you so much for your deliberation.
It's my pleasure. Privilege, ma'am.
Once again. And Dr. Poonam, any last comments?
Yes, just like you, I'm also actually amazed with the presentation. It was awesome, and it was a complete one. Actually, she tried to touch each and every point regarding mommy makeover. So we are very happy that, and the same I think the whole audience would be feeling, because it was an overview, and it was really an overview. It was the complete one. Now each and every procedure needs a separate session actually. So so we would be trying to cover each and every aspect of mommy makeover, every procedure separately in our further discussions. And now the questions, if they are there in the boxes, are welcome. So, Mr. Suman, is there any question?
Madam, one question is, in case of liposuction, what precautions should be measured prior to the surgery?
For liposuction, what happens is, as I made a mention, liposuction, there is a lot of times it's not a synonymous for a slimming procedure or a slimming operation. You need to get that fact very correct. Of course, whenever a patient comes over and is willing for liposuction, first is you look forward what the patient actually wants, a very well sculpted, well chiseled body. Okay, fine, great. But the thing is, has the patient put in the effort? Of course, we prescribe diet charts, which you have to follow for minimum 3 months. There is an exercise routine, not very aggressive, very, very practical. Even if you practice this just 5 days in a week, results are visible. When even after doing that, the results are not visible, and that's how I label even my presentation, calling the stubborn fat. So liposuction per se is for the stubborn fat. That is when okay, yes, this is the candidate we should be going. It's not in just the first step, the patient wants to slim down or cut down certain zones of fat and you opt for it. No, the assessment is very, very important, and that's where the patient selection plays a very important role. I hope I answered your question.
Thank you. Thank you very much.
Yes.
So, Dr. Chandni, what is the average fat volume that is recommended at any average liposuction session?
It actually depends, ma'am, because it also depends on what weight you're starting with, because there could be somebody who is weighing more than 100 kgs, or somebody who is more beyond or less. So your body weight, the starting weight, and it plays a very, very crucial role. So per se, there is no defining factor that so many liters of fat that you can very safely do it. At times we can go a little more beyond, at times we go quite less. So it's absolutely, you can say, pertaining to that patient profile.
Yeah, so on an average, say around 5 liters is safe? 5 to 8 is what mostly plastic surgeons deal with.
Yes. That is a safer zone, around 5 to 6.
Yes. Yeah.
Right. So, thank you
5
so
to
much.
6, or sometimes they try to remain in between 3 to 5 liters in an average patient.
Yes, you're right.
Whatever I know.
Yes. By far, like it's like 5, around 5, plus minus. So that's the safer one.
Sure. So, any last questions anybody has? I guess we would be in the coming sessions taking these things in more detail, and we hope to have more interactive
Plastic surgeon with us, who's there to guide us. The fact the whole body is measured. What do you say, Dr. Seema?
Sorry, I didn't get your comment.
Am I audible?
Yeah, no, ma'am. There was a glitch in your network. Even I couldn't get.
Oh, I see. I was telling that it's a teamed approach. Aesthetic gynecology actually needs a team of doctors. So we should be having a plastic surgeon with us if we are literally going to get that liposuction done at our places. And proper liposuction with 5 to 8 liters of fat reduction. So, and up to us, that labia majora augmentation, mons plasty sort of things, and that vaginal filling with fats, just like fillers are being filled inside. So that needs actually very little amount of fat, and that is very well harvested from the sides of thighs and the lower abdomen and other parts. So there, I don't think that more than 500 ml fat is needed. So,
yeah.
Yeah. What is your take?
No, I think definitely, ma'am, it's a teamwork, and we have to work in collaboration, especially when it comes to, talking per se of today's topic with liposuction, tummy tuck, it's all about a teamwork. And there are a lot of gynecologists, gradually down the lane, we have started doing liposuction. Because yes, so gradually when you work in collaboration, you're working as a team, then you become very well versed with this procedure. Because I feel that of course we know the history says that gynecologists were the first to hit start with plastic surgeries, and very conveniently we slipped on this domain to plastic surgeons, and now we are taking it back.
Exactly. The first liposuction in the world was done by a gynecologist.
Absolutely.
So that is something that is so amazing. Exactly.
And yeah, so and I think it's all about teamwork. It is all about collaborating and giving the best and the finest results. And if you have a great team, I think it goes a long way, because under the same roof, you provide each and everything to your patient. And also on this note, I would say everybody who is inclining towards cosmetic gynecology, that you would say that tummy tuck is something which is not our domain. But believe me, the patient, you will be the first point of contact to your patient, because every pregnant female, every female who comes for preconceptional advice, or for that matter, a lot of teenagers who come over, they always say, ki, ma'am, my sister, my aunt, they have those stretch marks and, all this. And, that's the reason I'm not looking forward to become pregnant. So, you should be very well versed with all these terminologies, with all these aesthetic procedures, that how actually they are carried. Of course, when you start working in collaboration, you know things much more in a finer way. But at least having overview of what all we discussed today, the benefits, the risk, how it is done, it is must for everyone who is stepping into aesthetics.
Exactly. Very nicely explained. Thank you.
Thank you.
Thank you so much, Dr. Shamini. Yes. And Mr. Suman, is there any other question? Any more?
No, ma'am. No, ma'am.
There is only one this which I can see is, please suggest me where to start if I want to enter in field of aesthetic gynecology. So I want to say that, with no exaggeration, I would be, at the cost of being repetitive, I would like to say it's Dr. Seema Sharma ma'am and Dr. Poonam Mishra ma'am. These are two pioneers and the finest our country has in cosmetic gynae. And with Indian School of Aesthetic Gynecology, I think ma'am is going to be the game changer. So we have best of the pioneers. I think you are in the absolute right space.
Yeah, this is, thank you so much, Dr. Chandni, and you are also a part of this. And actually the motive, the vision behind this is Indian School of Aesthetic Gynecology is that everyone who wants to become an aesthetic gynecologist and want to join this branch should at least know for the initially that what it is, and should have an overview, just like today's lecture was for the overview. In the same way, everyone should be well versed with whatever he or she is going to pursue in the in future, and with a very good program. So we will also come up with some teaching programs and some diplomas and fellowships. We are trying to work over that, but we would be focusing on hands-on basically, because classes and presentations are there, and this would be a continuous process. Shield is there to provide the platform, and we ourselves are going to start some other lectures also. So we would be catering more and more number of gynecologists who are trying to be in the field and trying to learn something new, and we would be keeping on updating them. But yes, we would be focusing on the hands-on, and we would be doing these training programs at such centers where actually patients' input is there, not only the demonstration of machines, but also on patients, whatever we are doing in our clinics. And we would be trying to produce perfect aesthetic gynecologists. So
that's a boon.
So Dr. Seema, now you are needed for the closing remarks. Please.
No, really, I don't have any more remarks. I think we will be looking forward to more such sessions, and more details are going to be lapped up by our budding gynecologists. So really looking forward to that. Thank you so much for having me, and thank you so much, Dr. Chandni. Thank you so much, Dr. Poonam. Thank you, Shield. Thank you very much.
Thank you, Seema ma'am. Thank you, Poonam ma'am.
Thank you, dear.
Thank you, Shield. Thank you, everyone.
Thank you very much, madam.
Bye-bye.
Bye-bye. Bye, everyone.